I'm Itsik Levi. I'm the director of the HIV and STDs Clinic here at the Sheba Medical Center. But today I'm going to talk to you especially regarding STDs, sexually transmitted diseases. And God forbid, it doesn't mean that I will ever say don't have sex. You should have a lot of sex if you enjoy it, of course, only if you want it. But you have to protect yourself. And you know what? It's not that difficult. The most common STDs that we see now in Israel, but I must say it reflects what happens all over the world, are syphilis. You know, when I was at the medical school, maybe we saw one case a year. Now I see about 5 cases a week, and sometimes even more, so it's really a sharp rise. The second one is chlamydia, which is a very tiny bacteria, one of the smallest bacteria. It's very common, and usually in women it may cause PID and fertility disorders. And the third one is gonorrhea, which also is a larger bacteria than chlamydia. It causes more severe symptoms, and also it can cause you troubles from PID and fertility disorder until really systemic problems. Those were bacteria. Regarding viruses, the most common viruses that we see that are being transmitted sexually are HPV, human papillomavirus, which is the commonest virus which is being transmitted sexually, and the herpes virus, which about 15–20% of the population carry it. The other one is hepatitis B, which can be prevented by a vaccine, and I don't know why so many people are resisting this vaccination, which is really harmless but can prevent chronic hepatitis and even liver cancer. So please do it. Go and get vaccinated for HPV and for hepatitis B. The other things like gonorrhea, chlamydia can be prevented with the help of the use of a condom. So if you use a condom in every exposure that you may have, you'll be, it can prevent the disease, but not 100%. And you know what? It's okay to be infected with an STD. It happens. If you run, you can fall. If you have sex, you can catch an STD. But the important thing is to diagnose it and to treat it. So we call everybody who has a lot of sexual exposures, at least once every 6 months, go test yourself. Something will be fine. We can treat most of the things. There are actually 2 main ways of preventing STDs. The first one is vaccination. There are some diseases that you can prevent so easily by vaccination. The first, of course, is HPV. And in many places in the world, HPV was almost eliminated with the help of vaccine. Now, you should remember and carry in mind that HPV is the only virus which causes cancer that you can prevent. And it may cause cervical cancer in a woman, anal cancer, especially in MSM, and people who have anal sex. It can make you laryngeal cancer, and you can prevent all those with a vaccine. And if we are talking about prevention of HIV, you must remember that HIV, also it can be transmitted by blood, but it's mainly an STD. Most of the transmissions of HIV today is sexually, and it can be prevented easily, really easily, whether you use a condom in every contact, whether you take PrEP, pre-exposure prophylaxis, and if something happened, you go within 72 hours, but the closer to the exposure is better, to get a PEP, post-exposure prophylaxis. And this way, we really can prevent also HIV. But the best thing is to go and being tested, because if you will be diagnosed with HIV, you start therapy, and at least you will not be able to transmit it to other people.